You can just type it in.
People are joining. Just wait for 1 or 2 minutes. Then we'll start. Okay.
Okay. We'll start at 2:10 then.
Okay. All right, that's better.
But how are things otherwise?
Same.
Team?
Madhvi, Nazima, Dr. Sunil, please. On your videos.
Yeah, at least we can
Our team
turn on
can.
video for a minute and we can. Vinay, we are recording this session, right?
Yes, we are recording this session. Madhvi, Nazima, can you change your username? It is showing as Galaxy A31, Galaxy J6.
Hello.
Yes.
Yeah, this is speaking. So I'm opening my video.
Okay. Yeah.
Yeah, sure.
I think we can start now.
Okay.
Hello everyone, this is Anupma. Thank you so much for joining Stride Health webinar. This is our first session and hope you all are doing well at your place in this Corona time. This webinar is for 40 minutes only, so I don't want to waste my time. And over to you, Dr. Sudhakar. Please start.
Yeah. Any questions, you can type it on the chat screen and we'll get back. Host disabled attendee screen sharing. Vinay?
Yes, you can share. You can share your screen. If it is not allowing, I'm making you a host.
Okay. Okay.
Okay.
Yeah, it's not come. It's a host disabled attendee screen sharing.
Okay, now you are host.
Yeah,
Sir.
now
You
I
can.
will get it. Yeah.
Yes.
Yeah. Yeah, you can see my screen.
Yes, we can see.
Yes, sir, we can see your screen.
Yes, yes.
Okay. So I'll start. So this topic is about ergonomics. Hopefully, by the end of the talk, you'll learn some common causes of musculoskeletal problems associated with bad posture, how you can prevent them, and simple measures to treat. So, if you look at the normal spine, it is not in a straight line. It has bends. So there's a forward bend in the neck, backward bend in the mid back, and the forward bend in the lower back. So this bend is maintained by balance between the muscles in the front and back of the spine. So any prolonged abnormal posture would increase the strain on the spine and cause the surrounding muscles and ligaments to ache. So that basically is the cause of back pain and neck pain. So what common problems are associated in musculoskeletal? Your low back pain is common. Everyone in their lifetime will experience some kind of back pain. The duration and intensity might vary. Neck and shoulder is also common. Other repetitive strain injuries like neck, shoulder, wrist, elbows, hand, basically whatever abnormal postures or repetitive action you get, the muscles can ache, joints can ache. Apart from this, you have non-musculoskeletal issues like eye strain, headache, loss of sleep, and other psychological issues. So if you look at the anatomy of any joint, it has surrounding muscles which help in moving the part. The ligaments are the ones which connect between the two bones. The tendon is an extension of the muscle onto a bone. And apart from that, you have nerves and vessels which are responsible for circulation and sensory and movements. So any of these structures could be involved in a pain eliciting trigger. If you look for the reasons for the back pain, the spine has what we call a disc. It's basically a shock absorber. It takes the load and increases the flexibility of the spine. In a young age, before 30 years, it is jelly-like. It has a lot of water content. As you age after 30, the water content decreases, and what we call a degeneration happens. What we call a degenerated disc. Sometimes due to abnormal strains bending forward, the disc could bulge back. So this is a bulge back disc in an MRI scan. That's how it looks like. So the bulging back will cause surrounding muscles to go into spasm, and that causes muscle pain and back pain. Sometimes in severe cases, the liquid content herniates back, and that presses on the nerve, and that causes the nerve pain, what we typically call as sciatica. And in prolonged stages, the space could degenerate and become irregular arthritic, what we call a lumbar spondylosis. So any reasons of abnormal posture will increase the strain on the back, and the muscles go into spasm and causes back pain. Like I said, if there is associated nerve pinching pressure on the nerve on the spine, then you get pain radiating down the back of the thigh and calf along the sciatic nerve, and the pain is called the sciatica. So typically the low back pain, mechanical pain is usually localized to low back. The 90% of the time, you don't usually have leg pain. The pain increases on movement, lifting, bending, or twisting, and there's a lot of muscle spasm. You feel like a swelling, but it's not actually a swelling, but it's a sore muscle, which is tender on touch. And the pain usually decreases on rest, and when you lie down, it usually decreases. Neck pain is also similar anatomy. You have the neck spine, cervical spine. In between, you have the neck discs or the shock absorbers. If there's any pressure on the nerve or if there's any herniation, abnormal pressures, the surrounding muscles go into spasm, and you get the muscle ache or the neck pain. And if it presses on the nerve, then you get pain along the distribution on the hand. So the typical neck pain is usually localized in the back of the neck here, more than 90% of the time. Very rarely you can feel it up the shoulder, and sometimes traveling down to your forearm and arm. Shoulder pain can happen due to abnormal posture if you're raising your shoulder and working on the desk for a long period. Other cause are repetitive stress injury. There's a muscle called the rotator cuff, which is responsible for lifting your shoulder up. When you keep your posture or your arm in a lifted or extended position, it usually gets pinched between the two bones, and that triggers a bit of inflammation and redness inside the joint, what we call as inflammation or bursitis. So typically when you raise your hand, it gets caught and increases the pain. And also when you lie to the side onto that's affected shoulder, you get the pain. Repetitive stress injuries or RSIs. Common example is in the wrist due to abnormal posture like this. If you work on the desk with the wrist extended or a bit pressed on the forearm or the wrist, there's a nerve in this part called the median nerve, which gets compressed, and you get pain around the distribution of the hand, what we call as a carpal tunnel syndrome. You get symptoms are usually discomfort, tingling, numbness, heaviness, and sometimes associated with night pain. And in very severe cases, you tend to drop things due to severe muscle weakness. Other repetitive stress injuries can happen in the wrist. It's a typical thumb. When you're working on your mobile, texting a lot, you get irritation on the thumb, base of thumb region, and also lifting things untoward activities could cause pain around the elbow due to pull of the muscle. So what simple measures you can do? So obviously this is not a good posture. If you sit in this posture for a long period, you strain your neck, you strain your back, and then after 10 minutes, the muscles go into a lot of stress. So you can take simple measures like draw your chair in close to the desk, keep your back straight, lean against the back, and keep the monitor at the same level as your eye. So ideally, the workstation should be like this: back support. If there is not sufficient back support, you can put a pillow to rest your low back. It should have a sufficient arm rest also to rest your elbows, so that your shoulders are relaxed. Forearm hand extension of the keyboard desk would help in relaxing the wrist, avoiding pressure on the wrist. The monitor should be at the same level as the eye, about 1 meter viewing distance. If there's a document holder on the side of the monitor, that's equally good. So it avoids infrequent bending down your head and looking onto the table. That avoids neck pain. The foot should be planted on the floor, relaxed at 90 degrees, and that takes the pressure of the hips and knees. Other simple measures you can do is to avoid, you can arrange your desk so that you avoid work, avoid unnecessary motion. So the repeated work stationary, you can put it close to you, and the frequent object, frequently used, seldom used ones, you can keep it far apart so that you're not bending forward and stretching yourself as you work. Frequent stretches and pauses, frequent repetitive actions should be avoided, and it's better to take adequate pauses. And in between stretches, stretching your shoulders, stretching your neck, back, every half an hour or so would certainly relax the muscle. Come to good standing posture. So when you stand, ideally the head, chest, buttocks, and the legs should be in the same straight line. The feet about 1 foot apart would balance the body. You can check yourself by doing a wall test. Lean against the back of your back of the wall. So it should the head, chest, and back should touch the wall, and there should be a hand's breadth gap in the lower back region. So that's a good standing posture. And when you are working on the kitchen or that washing dishes, and if you are straining yourself, it's better to use a footrest so that the hip and back muscles are relaxed. And you can swap over to the other side every 10-15 minutes so that the back doesn't get stressed. About lifting, proper lifting, bending, and pickup techniques. So in the top picture, obviously, if you're bending like this, the spine would take a lot of load, and you'll herniate your disc and causes acute back pain. So proper posture is to bend your hips, knees, sit down, grab the object close to your body, and by keeping your back straight, you raise your knees and hips and lift the object up. And it is also important while you're washing yourself at the sink. So avoid bending forward of the spine. You can lower your hips and then wash your face, and lifting your knees up, you can straighten yourself. So that will avoid acute back pain. Ideal position while sleeping. So most people, some people tend to lie in the back, some people on the front, some people on the side. But from the spine point of view, the ideal position would be lying to the side. That's where the spine is straight. And again, when you're lying to the side, make sure that you have a good pillow that and your head and chest are in the same straight line. Avoid bending your neck awkwardly, if you or else you'll be waking up with a sore neck. And if you can't help lying back, you can relax the back muscle by putting a pillow behind the knees, and that will relax the back muscle. And also the neck pillow should be a sufficient height so that the head and chest should be at the same straight line. So about simple measures to take once you have a back pain, acute back pain, or back pain, or it could be a low back or shoulder pain. So the main key is to remain active while avoiding physical activities that trigger pain. So basically, you avoid lifting or twisting activities that trigger the pain, but you remain yourself active. You can take brief for 1 or 2 days of rest in bed if the pain is very severe. You can apply localized back or a heating pad, certain painkillers and muscle relaxants. Short-term period could also help in relaxing the muscle. But most of the time, muscle pain, acute back pain, neck pain will get resolved in about 5 to 10 days. If just simple measures doesn't help, you can see a physiotherapist where they'll try a lot of other modalities of pain management like IFT, infrared therapy, ultrasound, acupuncture, laser therapy. So basically, that heat up the sore muscles, and that will decrease the inflammation. Once the pain has come down, you do strengthening
exercises. So, Dr. Sudhakar, sorry to interrupt.
Yeah.
I think there are a couple of people waiting to be logged in. So, as a host, you need to allow them to get in. So, there will be a message popping up to allow.
Okay.
Maybe, Vinayak, can you see?
No, I cannot see. Dr. Sudhakar, please click on participants box or make me host.
Okay.
Yeah, make poster. Make Dr. Vivek change host.
StrideHealth.
Okay. Can you see my screen?
Now, Vivek, you are host. Vivek, you can see.
Okay, let's continue.
Yeah, can you see my screen or is it stopped?
Yes, we can see your screen. You can continue.
Yeah, so I'm allowing people to admit all.
Yes.
So and allowed, yeah.
Yeah, Vivek, you can be host now. No problem. And Dr. Saab, your voice is very low. Can you please speak a little bit loud?
Yeah.
Sure, thanks.
The volume. Okay. Can you hear now?
Now it's okay.
Yeah.
Yeah, you can see my screen, everyone?
Yes.
Yeah. Okay, to continue, the neck after physiotherapy exercises would also help in increasing the decreasing the inflammation. The exercises are important to increase the core muscle strength, okay, to prevent further attacks. And other lifestyle changes you can do to improve or prevent neck and back muscles. Main thing is to improve your physical fitness, particularly the core muscle strength, which help in supporting the low back. Losing weight will also decrease the strain on the joints, strain on the spine, strain on the muscles, and using proper posture and body mechanics, like I explained earlier. Avoid a sedentary lifestyle, and the key is to remain active. And stopping tobacco use of nicotine also would decrease would promote faster muscle healing. The simple stretches at work you can do, like after every half an hour of sitting, you can just stretch your wrist, to stretch your neck, shoulder, back muscle. Do it for 5-10 minutes, and then go back to your work. That will avoid the strain on the muscles. So these kind of exercises you can do at home. This can be done in both the acute phase or chronic phase. So lying back, bending your hips, knee onto your body, bending and rolling towards one side. That will improve the abdominal muscles, the back muscles. And in the chronic phases, you do these kind of core exercises to improve your abdominal muscles, back muscles. you can see the physiotherapist or fitness trainer to get further information. So this is also a good exercises to improve the core muscles, called what you call a plank, to make your body as a table. And if you can lay in this position, that will improve the back muscles and gluteal muscles, thigh muscles, and abdominal muscles. And there are advanced planks as well. Other modalities you can try is also, you can try the meditation breathing exercises. This is also particularly good in increasing the oxygenation capacity of the muscles. So once the muscles get good oxygenation, they tend to heal faster and the soreness will reduce quicker. And also it improves the sleep pattern. So adequate 8 hours of sleep, good adequate sleep is required for the muscle to recover. So when should you consult a doctor? So these are a few symptoms or red flag signs you should watch out for. And so if the symptoms are persisting, if they're persisting more than 6 to 8 weeks, so then you need to check out and see if there's nothing organic lesion inside. If there is associated fever, associated rest pain, night pain, that indicates more severity or something not right inside. And you need to rule out any physical causes by blood test or a MRI scan. Any associated leg pain, arm pain, numbness, tingling would indicate the nerve is under pressure and it involves further investigations. Back pain in young people is also unusual. Unless they have some organic lesion, and it is better to check it out before attributing it to a mechanical back pain. And similarly, more than 65 years, back pain sometimes could be due to weak bones, osteoporosis, or other pathological factors, which should be first ruled out. And then if it is just a age-related spondylosis, then you can continue your exercises and physiotherapy. Upper back pain is also unusual. If it persists, then you should see a doctor. And giddiness, difficulty in walking, imbalance, this also indicates the severity of the compression. Loss of control, bladder, bowel frequency would also indicate the nerves affecting the urine and bladder and the bowels are getting involved. And that indicates the severity. So these are all the red flags we should keep in mind. And if any symptoms are present, then you should seek medical advice. So apart from this, there are a few yellow flags which indicates poor outcome. That means if the symptoms or the like back pain or like neck pain or shoulder pain will take a long time to resolve. If any of these associated features are present, like stress, anxiety, depression, when people think that it is whatever the pain you are experiencing is severely disabling and it is harmful to you, and you're having a low mood and social withdrawal. So if these factors are there, then the resolution is also prolonged, and measures like meditation, breathing exercises would also help. So to summarize take-home messages, proper workstation setup and good work habits are important. Take frequent rest breaks. Exercises at work like stretches every half an hour. Take stretches and do stretches for 10-15 minutes. Core muscle strengthening exercises are important to improve the spinal muscle strength to prevent further recurrences. And look out for the red flags, symptoms and signs that I have mentioned earlier. And take early medical advice, symptoms are persisting or worsening. Okay, any questions? It's the end of the talk. We'll take any questions if there's any. Okay. Sunil, you
Yeah,
able to hear me?
Dr. Sudhakar Reddy, few people are asking few questions. Like some
Yeah.
people are complaining for vertigo issue.
Yes. Giddiness, vertical giddiness, if it is associated with neck movements, like when you extend your neck or lift your head up, and that is associated with giddiness, then most likely it is the spondylosis or the neck cause. Uh, because there's sometimes there could be decreased circulation to the brain when you extend your neck, and that sometimes causes vertigo.
Okay.
But giddiness would also indicate some other causes as well, which need to be ruled out. But if there is a associated giddiness on neck movements, then it is most likely coming from the neck. Then resting and taking some muscle relaxants, anti-vertigo medication would also help. And then strengthening your neck muscles would also prevent further attacks.
Okay, and next question is L4, L5 pain, office job on laptop.
L4, L5 is the diagnosis from the MRI or the X-ray, where there is, like you said, it's a common area of the disc space narrowing in the lower lumbar region. Okay, but the decreased space narrowing is not the cause, but the triggering factor is the pressure on the disc, and the surrounding muscles joints will cause spasm, and they get inflamed, and that causes pain. Like I said earlier, most of the time, if it is mechanical, like the pain is, if it is localized to the low back, and if it is just acute, it gets resolved with adequate rest. Simple measures like local cold pack, hot pack, and then sometimes muscle relaxants would help. And then once the pain has come down, then you do exercises to strengthen your back muscles. That would prevent further attacks. And if the pain is followed by leg pain, and the pain is going down to leg, and that is severe, and that indicates pressure on the nerve at that region, L4, L5. That will be confirmed with an MRI scan, and depending upon the severity, further intervention is required.
And next question is, how much time should we work on computer without break?
Yeah, usually not more than half an hour continuously. At least couple of minutes of stretches after half an hour, or five minutes break after 1 hour is recommended.
Okay. And one question from Mr. Ajay. I had a compression fracture in L1 2 years back. Can I still include in back exercise? It was L2.
Yeah, if it's 1 year back, the bone would have healed, but there'll be some malalignment or bend in the bone. But it's important to strengthen the muscles around the back region. Okay. And if the X-ray is okay, there is not much of further progression, then usual measures will be back exercises, strengthening exercises.
Okay, fine. And I think we have sufficient time. Vivek, can you please unmute to all?
Yeah, sure.
Yeah, please,
We can unmute to all, and all people can ask questions.
directly ask their questions.
Yeah, and I think Ajay Majumdarji, thank you for joining. You can ask your question, the follow-up on that you have.
Thank you, Dr. Vivek. I was just wondering, since I had a compression fracture in L2, I'm otherwise okay. Can I do plank exercise?
Dr. Sudhakar, you are on mute. Please unmute yourself. Once again.
Yeah, can you hear me?
Yes, we can hear you now.
Yeah, I presume that spine fracture was stable and it has healed with an X-ray, follow-up X-ray.
Yes, sir.
Yeah, a plank exercise doesn't strain on the spine.
Okay.
It strengthens the surrounding spinal muscles, the back muscles, the front muscles. Okay. Only thing is, if you are having back pain, avoid bending and lifting. Those exercises, avoid it.
Okay.
But apart from that, you can do other exercises lying down on the bed, lifting your leg up, bending your knee onto your tummy, and the planks are also good.
Thank you, sir.
Yeah. I see someone 1, 2, 3, 4, 5. Maybe if you can tell your name and ask your question. I know that you have posted one question here. Sudden standing after sitting, lose controls.
What's the question?
I think it
Doctor,
mentions.
question is sudden standing after sitting, lose control on body frequent.
Yeah, that means the muscle strength is not adequate. Okay. If it is the entire body, then something wrong, not right with the body. But if there is any weakness in one part of the foot, then it is due to any nerve pressure. But if it's a complete body, then it is usually the core muscles which are not giving adequate support. So fitness training, physiotherapy, exercises, core muscle strengthening are important.
So Dinesh, I know you have also joined. Thanks for joining. Do you want to put up your question? Any follow-up you have? How?
Actually, I got the answer of the questions. So I had only 2 and 3 questions, and Dr. can basically given the answer. Yeah.
Okay, very good.
Dr. Sudhakar, what exercise for lower back pain after getting up in the morning? Can you guide?
Early morning pain.
Yeah. Yes.
Okay, and that is for a few days, if it is acute.
Yeah, it's for like from last 1 week I'm facing this pain, so that's why I'm asking you.
Yeah. Sometimes you get pain early in the morning. That's once you get up, the muscles are not strong enough for you to lift your body up. Okay. If it is, again, the stretches would help. Lying down flat, bending your knee onto your body, then planks would help. Okay. Only thing is, while getting up, avoid getting up with the bent back. Roll to the side and then get up. That will take the pressure off the back. Okay. People tend to get up with bending the spine, and that will have load on the low back region, and that triggers the pain in the morning.
Okay. Thank you so
Along
much.
with that, core muscle exercises are important as well. And when you go to the washroom, avoid bending forward. Keep your back straight and bend your knee and hips, and then wash yourself. That will avoid again the strain in the back early in the morning.
Thank you so much. And my friend asked me one question, like after post-pregnancy, when we can start exercises? Like it take 2 months, 3 months, 4 months, when it's comfortable, like our body is okay for doing exercises.
Yeah, simple stretches you can do immediately, but main thing is bending forward, those kind of things, lifting weights. You say avoid for 2-3 months till the ligaments and muscles are the strength has recovered. Okay, and gradually you need to.
How much time it take to recover?
After pregnancy, it will take 2 to 3 months.
2 to 3 months. Okay.
2 to 3 months, but it again depends upon what exercises you're doing, what exercise you're doing to recover the muscle and strengthening the muscle.
Okay.
If the muscles are not strengthened, then again they cause strain when lifting and bending.
Okay.
After pregnancy, the muscles, ligaments are lax, and then you need exercises to strengthen them.
Thank you. Thank you so much.
I think someone has question. So yes, you can ask verbally. I see the name iPhone.
Yeah, hi. This is Anjali here. Dr.
Yeah.
Sudhakar, good afternoon. I have consulted you before, and I've taken physiotherapy also in Stride. Recently, like, when I'm continuously sitting in front of system, I mean, I do take breaks, but then when I try to move my right leg slightly from the position, like if you're sitting facing the computer, I move a bit at certain angle, I get a knee lock. Why is it happening? I mean, it is unbearable, pain I get.
Yeah, it's only on one side.
Yeah, it's only on the one side. Yeah, the exterior part outside.
And the knee lock means it gets jammed in that position. You can't bend it. You can't.
Yeah, I
straight.
can't move, and I'll be screaming with pain. It'll be unbearable pain. It'll be like for few seconds.
Yeah.
I think the worst pain I got was 3 months back. I was on a call with a client on my office job, and everyone heard my scream. It was that bad.
Yeah, usually it comes from behind the kneecap, we call it patellofemoral pain. Okay. Sometimes for some people, the nerves are very sensitive behind the kneecap. The main thing is to strengthen the thigh muscles, what you call the quads exercises. That will take the tension of the joint. Okay.
Okay.
Anything
Anything specific that I need to avoid, doctor, in terms of like the exercises? Like I do basic yoga, but I don't want to do advanced. Yeah.
Yeah, if you're getting knee pain, locking pain, anterior knee pain, then main thing is to avoid squatting and getting up and stairs. That will increase the strain on the joint. And once you develop your strength in the thigh muscle, that will take the pressure of the joint, and then you can do more of stairs and squatting.
And also, doctor, at night when I'm sleeping, also in between, I get up with pain, because even though I elevate my leg on a pillow, still I get too much of pain, and it radiates till low back and sometimes till the ankle. It's only on this right leg.
On the right side. Is it like a cramp, muscle cramp you get in the calf?
No, it will be a pulling sensation. It's not cramp. It's not localized to one place though. I mean, I just can't define, but I mean, the worst pain starts off from knee, and then it radiates up to the low back.
Yeah, unusual. And it is a day, or how frequent is it? Or very occasional?
Yeah, it's quite frequent. Yeah, quite frequent.
Okay. Yeah. And if there is any nerve irritation also, you get the pain down the leg. Okay. And this pain doesn't happen when you stand up, walk?
No. Only under rest. Even when I'm sitting on chair also, I get this pain. And the days I work long in front of system, it worsens even more. But if I'm lying on bed, or just stretching my leg and holding laptop on my lap, I feel that more comfortable than sitting on a chair.
Okay. Thing is just the irritation of the nerve around that region. Sometimes one particular nerve will be affected more, and then the muscles are more hyperstimulated. Okay? As long as but it's important to get investigated first. If it's been going on for a long time, I presume you had a scans done, MRI, and rule out other underlying causes. It shows nothing insignificant. Then you can continue your exercises. Okay, but if you're getting your sleep disturbed, then it is better to get investigated first, with at least with an MRI of the spine.
Yeah, sure, doctor. Thank you so much.
Yeah, and Kameshwari ji, you can ask your question Telugu as well if you want.
Yeah. Hello. Namaste andi.
Namaste, చెప్పండి.
ఏం లేదండి, నాకు ఒక 6 months నుంచి ఇక్కడ పెయిన్ C5 C6 దగ్గర, అంటే ఎక్స్రే తీసాము, MRI కూడా తీశారు. సో నెర్వ్ ఏదో పించ్ అయిందని న్యూరో డాక్టర్ గారి దగ్గరికి వెళ్ళాను. ఆయన మెడిసిన్స్ వాడుతున్నానండి ఇప్పుడు. దాంతో పాటే కొంచెం యాంగ్జైటీ లా కూడా వచ్చింది. కొంచెం అంటే నీకి నెక్ కి ఒకేసారి వచ్చేటప్పటికి వర్టిగో అవన్నీ వచ్చి కొంచెం ఎక్కువ ఇదైంది, ప్రెషర్ పడింది. సో యాంగ్జైటీకి ఎట్లాం ప్రో అది ఒకటి నైట్ వేసుకుంటున్నాను, అంటే ఇప్పుడు హాఫ్ టాబ్లెట్. నెక్స్ట్ గాబాపిన్ అది న్యూరోది అదొకటి వాడుతున్నాను.
చేయి లాగుతుంటది ఏమన్నా చెయ్యి?
ఈ 2 చేతులు ఇదంతా నొప్పండి.
అదే
ఇదంతా పెయిన్ వస్తుంటుంది. చేతులు వీక్నెస్ అది ఉండేది, ఇప్పుడు వీక్నెస్ తగ్గింది. బట్ నెక్ మెయిన్ ఇక్కడ నుంచి మన ఈ షోల్డర్స్ ఇక్కడ వరకు చాలా పెయిన్ ఉంటుందండి.
అదే కొద్దిగా సర్వైకల్ డిస్క్ ఉండొచ్చు, కొద్దిగా నర్వ్ మీద ఇరిటేషన్ ఉంటే అలా కొన్నిసార్లు షోల్డర్స్ మీద.
అవునండి, అది ఏమని వచ్చిందంటే డిఫ్యూజ్ డిస్క్ బల్జ్ అట్ C5 C6 లెవెల్, ఐడెంటింగ్ టెకల్ సాక్ అండ్ నారోయింగ్ ఆఫ్ బైలాటరల్ న్యూరల్ ఫోరామినా అని వచ్చిందండి.
అదే కొద్దిగా నరం మీద కొద్దిగా టైట్ ఉంది. మెయిన్ గా ప్రికాషన్స్ ఎక్సర్సైజెస్ దీంతోనే చేసుకుంటాం. మెడిసిన్స్ కూడా ఇచ్చారు కాబట్టి గాబాపెంటిన్ అది కూడా నరం మీద పనిచేస్తుంది. అది కొన్ని రోజులు
అంటే అది 3 months అయింది కన్సల్ట్ చేసి న్యూరో డాక్టర్ గారిని. ఇప్పుడు వెళ్ళాలంటే కొంచెం కిమ్స్ లో చూస్తున్నారు. ఇప్పుడు ఈ టైంలో వెళ్ళడం కూడా ఇది అని ఆగాము. సో అది కంటిన్యూ చేయొచ్చా ఇంకో 1 month అట్లా?
అంటే రోజుకోటి వాడుతున్నారా నైట్?
గాబాపిన్ అది మార్నింగ్ హాఫ్ ఈవినింగ్ హాఫ్ అండి. నైట్ ఏమో ఎటిలాం ప్రో హాఫ్ వాడుతున్నాను.
అది ఉట్టి నెక్ పెయిన్ ఉంటే అంత అవసరం లేదు. అది షోల్డర్ దగ్గరికి వెళ్తుంది అనుకుంటే కొన్ని రోజులు వాడాల్సి వస్తుంది. అది
ఓకే.
ఓన్లీ నెక్ పెయిన్ అదే ఉంటే మజిల్ రిలాక్సింగ్ సరిపోతుంది. కానీ ఇటువైపు వెళ్తుంది అనుకుంటే అది నరం నొప్పి అన్నమాట.
అంటే ఇక్కడ వరకు ఉంటుందండి. అంటే మా ఇంట్లో కిచెన్ లో వర్క్ అది, నేను హౌస్ వైఫే, బట్ ఈ వర్క్ వల్ల కొంచెం ఎక్కువ పోటు వచ్చేస్తూ ఉంటుంది.
అదే అంటే దానికి మెయిన్ గా ప్రికాషన్స్ ఎక్కువ బెండ్ అవ్వను చూసుకోవాలి, కూర్చున్నప్పుడు సపోర్ట్, ఇంకా నెక్ ఎక్సర్సైజ్ రెగ్యులర్ గా చేస్తూ ఉండాలి.
అంటే ఆయన జస్ట్ ఇలా ప్రెసింగ్ ఒకటే చెప్పారు 4 వైపులా, ఇంకేమైనా రిలీఫ్ ఇచ్చే ఎక్సర్సైజెస్?
పైకి లేపుతాం మళ్ళీ కింద గంటాం, పైకి లేపుతాం మళ్ళీ కింద గంటాము.
ఓకే అండి. ఓకే. అంటే ఇది ఫ్యూచర్ లో ఏమైనా ఫిజియోథెరపీ అలా చేయించుకుంటే ఈ పెయిన్ తగ్గుతుందా అని?
అదే ఫిజియోథెరపీ కూడా ఇంకో మొడాలిటీ. ఇది కూడా IFT అల్ట్రాసౌండ్, అది కూడా మజిల్ రిలాక్సేషన్ పనికి వస్తుంది. మజిల్ ఈ నొప్పి తగ్గట్లేదంటే అది కూడా ఒక ఫిజియోథెరపీ. IFT అల్ట్రాసౌండ్ అంటున్నారు కదా, అది కూడా మజిల్ రిలాక్స్ అవుతుంది మెడికేషన్. దాని తర్వాత ఇంకా ఫ్రీక్వెంట్ గా అవ్వకుండా ఉండడానికి మజిల్ స్ట్రెంథెనింగ్ ఎక్సర్సైజెస్ ఇంపార్టెంట్
చేయాలి
రెగ్యులర్ గా. ఓకే. అంటే డిస్క్ బల్జ్ అంటే కొద్దిగా మైల్డ్ గా ఉంది, ఇంకా ఎక్కువ అవ్వకుండా చూసుకోవాలి అంతే.
ఓకే. అంటే ఇది పెయిన్ ఆఫ్టర్ డెలివరీ ఒక 8 years నుంచి ఉంది, బట్ మేబీ అది ఇప్పుడు నర్వ్ మీద పడినట్టుంది.
అది కొద్దిగా నరం మీద ఇరిటేట్ అవుతూ ఉండొచ్చు. దానికోసము ఎక్సర్సైజెస్ ఇంపార్టెంట్ ఫ్యూచర్ లో, ఇంకా ఎక్కువ ఉంటాయి.
ఓకే. ఫ్యూచర్ లో ఈ ఫిజియోథెరపీ ఒకసారి ట్రై చేయొచ్చు?
అది కూడా ట్రై చేసుకోవచ్చు. అది కొన్నిసార్లు అప్పుడప్పుడు ఫ్లేర్ అప్స్ వస్తుంటాయి. వచ్చినప్పుడు మళ్ళీ మీకు కొద్దిగా రెస్ట్ తీసుకోవటము, మళ్ళీ తర్వాత గ్రాడ్యువల్ ఎక్సర్సైజ్, స్ట్రెచింగ్ ఎక్సర్సైజ్ చేసుకుంటూ ఉంటాం. ఆ బల్జ్ అనేది అలాగే ఉంటది, కాకపోతే ఆ కంట్రోల్ గట్టి చేసుకుంటే హెడ్ కి నెక్ కి సపోర్ట్ ఉంటుంది.
ఓకే. అంటే ఈ నర్వ్ ది ప్రాబ్లమ్ సాల్వ్ అవుతుంది అంటారా? అది
అడ్జస్ట్ అవుతుంది, అడాప్ట్ అవుతుంది అంటే మైల్డ్ గానే ఉంటాయి.
ఓకే.
ఒకవేళ తిమ్మిళ్ళు కలుగుతాము, తిమ్మిళ్ళు ఎక్కువ అవుతుంది,
అవన్నీ ఉండేవండి ఒక 6 months నుంచి. అన్ని చెయ్యి రైట్ హ్యాండ్ బాగా తిమ్మిరెక్కిస్తుంది.
అది పద్దాకా అదే అలాంటిది పద్దాకా ఒక 1-2 months కన్నా ఉంది, తగ్గట్లేదు అనుకుంటే అప్పుడు ఏమైనా ఆపరేషన్ అవసరం పడుతుంది. కానీ అది లేదు, ఉట్టి నెక్ పెయిన్ ఉందంటే ఎక్సర్సైజ్.
అంటే ఇప్పుడు అవన్నీ తగ్గాయి, కొంచెం అప్పుడప్పుడు కళ్ళు తిరుగుతూ ఉంటాయి, అంటే వీక్నెస్ లాగా చెమటలు పట్టేసి అదర్ టెస్ట్లు అన్ని చేయించా, అన్ని నార్మల్ ఉంది, ఇది ఒక్కటే ప్రాబ్లం వచ్చింది. మామూలు జనరల్ చెకప్ లో అన్ని ఓకే.
మెయిన్ ఎక్సర్సైజెస్, మజిల్ రిలాక్సెన్స్ అప్పుడప్పుడు వాడచ్చు. గాబాపెంటిన్ ఎలా వాడుతున్నారు కాబట్టి ఇంకొక కొన్ని రోజులు వాడచ్చు. ఒకసారి ఫిజియోథెరపీ కూడా ట్రై చేయండి.
ట్రై చేయొచ్చు అంట. ఓకే. ఇక్కడ బయట అంటే కన్సల్ట్ చేయొచ్చు కదండి?
చేసుకోవచ్చు. అదే 10 రోజులు IFT చేయించుకొని దాని తర్వాత ఎక్సర్సైజ్ మీరు ఇంట్లోనే చేసుకోవచ్చు.
ఓకే సార్, థ్యాంక్ యూ సో మచ్.
I think Ajay, you have one follow-up question regarding the sleeping pattern, right? That whether you can sleep on side. You want to go and ask this question in detail?
Sleeping patterns.
Yes, Dr. Jha, I just wanted to know whether sleeping on one of the sides at night is advisable as compared to sleeping in the prone position or in supine position.
Prone is not advised. That increases strain in your back.
Okay.
Like I said, sleeping to the side is better.
Okay. Any particular side is better?
Any side from the spine, any side is okay. But if you want to lie on your back, you can keep a pillow behind the knee if there is back pain. Okay.
But during COVID, some of the doctors were advising that sleeping in prone position increases the volume of our lungs and we are able to intake more oxygen.
Yeah, that is if you are affected with corona and you got some breathing problems.
Okay.
Okay.
But otherwise, normally it is not advised.
Not normally for normal healthy individuals, it's not advised.
Yeah.
Okay. Thank you so much.
And Ajayji, you can put some pillows in between. We have some posture guideline that when we are sleeping in the left or the right side,
okay,
where you need to put the pillows. You need to put some pillows in between your knees if the back pain is there. And so please follow that as well.
I'll do that. Thank you so much.
Thank you.
I think Mr. Prashad has joined as well. Any question from you, Mr. Prashad? Gopal Prashad, Gopalji. Or Sudhirji.
I think everyone's queries Dr. Sudhakar has covered.
Okay.
I think we covered all the questions, so we can conclude the session for today.
Yeah, thanks everyone. Thanks for
Thank you so
joining.
much,
Thanks everyone.
Dr. Sudhakar.
Thanks Dr. Sudhakar. Thanks Vivekja.
Yeah, for guiding us. Thank you everyone for joining us. For next session from Stride Health, we will definitely update you all. Thank you so much.
Thank you for conducting this wonderful seminar. It was very informative and very helpful. Thank you so much.
Thank you.
Thank you. Thanks a lot. Yeah.
So, Vinay, can we share the email ID in which people can further reach out to Stride Health if they have any questions or the number?
Sure. I am writing our mail ID in the text.
Yeah. Perfect.
This is our mail ID. You can reach out us on this.
Okay. Great.
Okay. Thank you for joining.
Thank you.
Yeah.
Bye-bye.
Thank you.
Bye.
Thank you, everyone.
Yeah. Ajay, thank you. It's very nice to hear your voice after a long time. I'm not sure if you can able to see each other.
It was my pleasure. It was my pleasure. The pleasure was all mine to be available and to share platform with you. Thank you so much.
Yeah. So Ajayji, you might have seen Anupama as well. She's my wife.
I did.